Joining us from Endpoint Homeopathic Clinic is Dr. Kelvin Kwarteng, and we're going to get into a conversation about gastroesophageal reflux disease, also known as GERD. Dr. Kelvin.
Yes, sir.
Happy New Year.
Many happy returns.
Yeah, it's good to have you back.
Yeah, it's good to be here, actually.
You're welcome.
Thank you.
All right, so GERD is like a big name, but I'm sure the problem is something that is quite common.
Yes,
people have it.
Yes, very common.
Talk to us about what it's all about.
All right. Let me wish our cherished viewers a happy New Year. And we pray that this new year brings us good fortunes and also good health.
Yeah.
And you know, we speaking of good health, I know a lot of people have actually made their New Year resolutions. And if I could ask, I don't know if you included your health in the New Year resolutions.
Oh, yeah,
we did include
for me, it was
health.
part.
It was part of Kweku's.
It was one of my main
He
things.
decided to do a lot of
that's wonderful.
tracks.
Yeah.
Okay.
Tracks.
So exactly. So
Yes.
I guess I would say what we're having a conversation about this, that for me, it's my New Year's resolutions are multi-track.
Okay.
So there's spiritual, there's health, there's academic, there's
That's
different
perfect.
financial.
That's
so
perfect.
definitely health is.
So I think it's good, but
Mine is written.
we can't say that's about a lot of people.
Oh,
you know.
yes.
No.
Yeah, most people don't include health in their New Year resolution. So I think it's high time we do that. We make it a conscious effort. We make it a deliberate attempt to stay healthy throughout the year. Because without health, you can't accomplish all the resolutions that you've actually set. So I think it's good. And back to the topic, GERD, gastroesophageal reflux disease. A huge name, but it is. Should I say it's concerning actually. We've all had heartburns before.
Yes.
We've all had one or two heartburns, say in a month or we've all experienced it before. And heartburns could easily go away, even without taking any antacid. Sometimes all you need is just a little amount of water. You drink and then you are okay. But there are certain heartburns that persist. They actually continue, they persist, and they affect the quality of life that you live. And those heartburns, they are classified as GERD, gastroesophageal reflux disease. So heartburns that are persistent, that are actually worrying, that are uncomfortable, discomforting, and such that it affects your life, your activities. We call those heartburns GERD.
Let me ask, so will these heartburns show up immediately after eating, regardless of whatever you eat? Or do they just exist all the time, whether you have eaten or you haven't eaten?
Okay, so with GERD, once you've had that condition, or once you've been diagnosed of that condition, there are certain triggers that actually brings it up. So certain foods you eat and you easily get heartburns. So certain foods that an ordinary person without GERD would eat and be comfortable, you would eat, and it would actually surface the heartburns. But with heartburns or with GERD, we eat and the food digests. So we ingest it in our mouth. The food travels through a muscular tube called the esophagus into the stomach. And stomach is referred to as gastro or gastric in medical terms. So that's the name gastroesophageal. So there's reflux, there's return of acid from the stomach into the esophagus. From the stomach into the esophagus. So when we eat and the food enters the stomach, acid or hydrochloric acid is produced to actually break down the food for enzymes to act on the food. And this acid is very corrosive, especially when it enters the esophagus. So in the stomach, there is a lining, a mucus lining
to protect
protecting it, exactly. So when the acid returns into the esophagus, then it causes irritation of the esophagus. And that is what we call GERD. So God, in his own knowledge, has actually created a sphincter, a valve, at the end of the esophagus. It's called the lower esophageal sphincter. Exactly. And that sphincter is supposed to operate the opening and the closure of the esophagus.
So we're looking at this image here on the screen. And it's showing us, so the lower esophageal
sphincter is there.
It's actually above the stomach.
Exactly. So it actually separates
the stomach from the esophagus.
From the stomach, actually. So food would enter would enter the stomach from the esophagus through the sphincter.
Okay.
So the sphincter opens, then food enters.
Okay.
Once the food enters into the stomach, the sphincter closes.
Okay.
It shuts tightly.
So you don't have a reverse.
Exactly. You don't have a reflux. And during digestion, the food is churned. So the stomach contracts. And by the contracting or the contraction, acid is spilled all over. So if there is a leakage in the esophageal sphincter, then acid gets back into the esophagus. Exactly. So that is the basis of.
With that, if you have an underlying ailment, let's say you have ulcer, does it trigger any?
So it's good. Ulcer or gastritis, inflammation of the stomach or ulcer is one of the causes of gastroesophageal reflux disease.
All the types of ulcers.
Exactly. Especially the gastric ulcers.
The gastric ulcers.
Exactly. Those ones that are in the stomach.
In the stomach.
So if you've had ulcers for a very long time without any proper treatment, then you risk the chance of getting gastroesophageal reflux disease. Yes.
You won't get a direct cure, but you get some form of relief if you are somebody who gets it very often, or I may have to see the doctor every time I get that.
And a very brilliant question. So I wanted to actually mention this. So with heartburns, you know, they could go by themselves. You could take an antacid and easily treat it at home. But with GERD, when you are diagnosed of GERD, it is a serious condition. You can't manage GERD in the house. So there are people who have GERD, they've been having recurrent heartburns, and they've been taking antacids, they've been treating it at home.
It doesn't go.
But it's recurrent. It's exactly repeatedly resurfaces. So if you've been battling with heartburns, you think it's just a common heartburn, which keeps on coming back. It is GERD. And GERD needs to be attended to at the hospital. You need a medical professional to actually attend to. The reason being that when consistent reflux of acid gets into the esophagus, there could be a time that it could inflame the esophagus. We call it esophagitis. Exactly. So inflammation of the esophagus. And this could lead to bleeding, variceal bleeding, esophageal bleeding, whereby people would vomit and they will see blood. They will actually, sometimes they cough and they see blood. And apart from that, there comes a time where the cells of the esophagus, they are different from the cells of the stomach, different from the cells of the intestines. But when you get consistent GERD or consistent heartburns, there comes a time where the cells of the esophagus are being replaced with the cells of the intestines. It's a condition called Barrett's esophagus. And that could lead to esophageal cancer.
Wow.
Exactly, yes. If care is not taken, it could easily lead to esophageal cancer. So that is the reason why you need to come to the hospital, where we will attend to you, we would undergo investigations and see if yours is getting closer to Barrett's esophagus, or if you are having any inflammation of the esophagus such that you need immediate attention. So you can't treat GERD at home. Normal heartburns, you can take antacids, but if it persists, if it bothers you, if it affects the quality of life that you live, then you need to do something about it.
How frequent should you be experiencing reflux for you to say, you know what, this is not normal, let me go and see the doctor?
Okay. So I wouldn't want to give a frequency. I wouldn't want to put the frequency in numbers. But the thing is, you know yourself, you know your body. If it recurs, if it's persistent, if it's bothering, if it's worrying you. So normal heartburns, we don't bother. So it comes, we take water, we sleep overnight, then it goes away. Exactly. We don't bother about it. But once it becomes a bother, then it's something that you need to.
So for example, you have heartburn, it's so challenging that you even have problems sleeping.
Exactly.
That's something
that is worrying. So you should seek for help so that we investigate and see if it is GERD.
Does it have anything to do with hiccups too?
No, hiccups are different, but people who have GERD actually exhibit hiccups as a symptom. Yes, so there are symptoms associated with GERD. And maybe we could
walk us through some of those symptoms.
So one is hiccups, as you rightly said. And the other one, we all know, heartburns. So you feel a burning sensation that begins from the stomach and will rise up into the chest. Sometimes it even goes into the throat. Sometimes people feel it in their jaws and all that. Even in their mouth, there's burning sensation in the mouth. There is regurgitation. So people eat And when they burp or when they belch, there's regurgitation of food and sometimes liquid. Which tastes bitter. So sometimes people will come to the hospital and say that they feel a bitter taste at the back of their mouth or the throat. So doctor, so they feel that bitter sensation. Then if you have GERD, you easily get satisfied despite eating something very little. So after eating very little food, you feel full, exactly. So early fullness, it's one of the symptoms. Then when it persists, it could go into the respiratory tract. So the reflux could travel as far as into the respiratory tract. And once it gets there, it gives you respiratory symptoms. So you could cough, you could have shortness of breath, and sometimes you could even have severe chest pains. And with that chest pains, people attribute it to a heart problem. So they will come to the hospital and say, Doctor, makoma yamiya. But it's nothing related to the heart. It's just that the esophagus is closer to the heart. You know, it's in the chest region. So where they feel the pain, they attribute it to the heart. Sometimes the pain could even radiate to the back. So sometimes you wouldn't even feel it in your chest, but rather at the back. And it's very severe too. Other people also experience belching or burping, excessive burping. So once they eat, then they start to burp. Some get nausea. They feel like throwing up. And others even go ahead to vomit, actually. Some vomit blood and all that. So
what's your line of treatment?
Okay. So at Endpoint Homeopathic Clinic, we first diagnose. So when you come in with symptoms of heartburns, we would have to diagnose, find out if it is nothing related to your heart, if it is nothing related to your respiratory tract, because all those are in the same region. So we would have to first take a proper history. So a professional, a medical expert would actually take you through proper history, where he will take a detailed history and get to know. After that, we will do examination. So we would examine the body and see where the pain is or where the burn is actually coming from. Then we will know. Then we follow it up with labs. So we have laboratory investigations that we will do, series of them. Then we can do imaging tests also. So we can do ultrasound, we can do endoscopy, where a tube with a camera is actually inserted through the mouth and into the esophagus and the stomach to see if there is any ulceration, if there is any inflammation in the esophagus. We do all these. Then once we find the underlying cause, we treat, we give you medications. So with the first medication that you'll be given, we have medications that neutralize acids. So we have antacids, our version of antacids. So we'll give to you, it will neutralize the acid, it will resolve the symptoms. We also have medications that reduce the quantity of acid that is being produced. Because excessive acid production could also cause a reflux of the acid back into the esophagus. So we give you something that can reduce the quantity of acid that the stomach produces. Then we also have medications that can heal ulcerations or inflammations also. Then we go ahead to treat the underlying cause of your gastroesophageal reflux disease. So it's sort of a holistic approach to treatment. We don't just give you medications for the heartburns that you presented, but we need to investigate, delve further and see what is actually causing your heartburns. Because we've had cases where patients presented with heartburns and upon investigation, it had nothing to do with the gastroesophageal reflux disease. It was heart related. Exactly. So heart attacks could also sometimes present as heartburns, not chest pains. It could present as burns. So if you don't investigate further and you just prescribe first aid or medication to take away the heartburns, then you are not doing
thinking about it. Imagine feeling like it's heartburn and you are taking Andrew's liver salts or whichever liver salts.
We do that a lot.
And then it's actually a heart attack that is coming. Goodness gracious.
It usually happens. We had a couple of cases like that. So had we not investigated, then we wouldn't have done the patient good. So it needs investigation, it needs proper detailed history. So from the history alone, you could diagnose. Then we examine and we further go ahead with the imaging and also the
How
lab.
do we prevent if you don't have GERD? How do you make sure you don't get GERD?
Okay, so there are certain triggers. So one is, so there are actually causes. We didn't mention the causes. So increased intra-abdominal pressure. So when you're pregnant, there's a possibility that acid will reflux. Because as the baby grows, it puts pressure on the abdominal content. So, and also obesity. So when you are obese, intra-abdominal pressure increases. Also, excessive production of acid, gastritis, H. pylori infection, and the rest. If you want to prevent GERD, or if you've had it before and you don't want it reoccurring, then you shouldn't eat late. So that is one thing. We all know that after eating, if you eat late, say 9 o'clock, 8 o'clock,
straight to bed.
Immediately you retire to bed. So you don't do anything, so you just sleep. And once you sleep or you lie flat, then you are giving the acid a chance to actually flow back. Exactly. So it's not advisable to do that. Then also you stay away from certain foods. So spicy foods. So those who like eating too much pepper, the spicy foods, that will trigger a heartburn. Apart from that, citrus fruits. So the oranges, the lemon, the lime.
Those that are acidic.
Exactly, those that are acidic. Pineapple is also a part. Then carbonated drinks. Our soft drinks, our carbonated drinks. The energy drinks or drinks that contain caffeine, too much caffeine. So excessive caffeine intake. So coffee. Exactly. So there's with coffee there is the decaf.
Are you going to drink the coffee while this one is telling?
So with coffee there's the decaf ones, but you know we
I don't have GERD, so I'm okay.
We actually benefit from the caffeine more. That is why we take coffee.
Exactly.
But there's the decaf. You know, it's never the same.
It's true. It's never the same.
So caffeine actually causes or predisposes you into getting GERD. Then eat in smaller quantities. So instead of eating a whole food at a time, divide the food into smaller quantities and eat at smaller, regular intervals. That one too helps. Then try and exercise. Exercise too, especially after eating. So you can go for walks. Nothing strenuous, but you can go for some brisk walking. Exactly. Or you can even walk around your house before you retire to bed. So those are certain things that we can do to actually help with GERD.
I like it. I like it.
We have the tendency to self-medicate. Immediately we feel a form of heartburn, a compression in our stomach. So we go for the very known ones, the Andrew liver salt.
Exactly.
Then my grandmother would say, Charlie, go buy G. The big G. You have to buy it and then toss it. And then you can relieve yourself.
Exactly.
The awareness creation, the education, if you would help by telling some of our viewers that you don't go straight to the self-medication if you get that.
So it's something we've been battling with. We've been advocating against self-medication. But I think it's a culture. We grew up with it. It's embedded in us. Our parents, we saw our parents do it. So your dad comes back from work, feels pains all over, sends you to buy a painkiller for him. He doesn't go to the hospital. So what I would say is that self-medication isn't warranted. It isn't a good practice. So people should desist from it. If you have any complaint or any symptom, you need to find out what it is, because it could aggravate, it could proceed to something that you wouldn't want. Just as we are saying that heartburns, common heartburns could actually progress to esophageal cancer. And with cancer, it's very deadly, especially with esophageal cancer, judging from where it is or where the esophagus is. It's closer to the heart, closer to the lungs. So the surrounding organs could also be affected easily when there is cancer of the esophagus. So why don't you go to the hospital, get a health professional, diagnose you, and prescribe medications for you to treat. So generally, self-medication is not a good practice, and we advise the viewers to actually desist from it.
Dr. Kwarteng, where can we locate you, the Endpoint Homeopathic Clinic, and then your services you provide?
Sure. So Endpoint Homeopathic Clinic, our headquarters is in Spintex, or at Spintex in Accra here. So Spintex Shell signboard. So you would find us over there. So if you are coming with a trotro, you just ask the maid to stop at exactly Shell signboard, and you see Endpoints over there. But we have other branches. We have a branch in Takrade. We have a branch in Techiman. We have a branch in Tema, Community 22. We have a branch in Kumasi. Then our new branch, newly opened, I think it's about 6 months old. It's in Eziama. Eziama is around there in Zima.
As you are heading towards the border.
Exactly. Exactly. So those around that place could also visit us. But we are offering free screening or free scanning as part of giving back to the society, because we've been in the system for quite a while, 11 years now, and exactly. So we are 12 years. Yes, 12. So we are giving back to the society, and one way of doing that is offering free scanning. So we know that women are battling with fertility issues. Women are having issues with their menstrual cycle and vaginal discharges. Sometimes they feel pain during sexual intercourse. We are giving the avenue to women to actually come and screen and take a scan for free. We are not charging anything.
Are
so
you adding cervical cancer? Are you adding
we,
that in there?
We actually take a scan, but we don't do the pap smear. Exactly. That one is very expensive,
very
so we can't do that for free.
I thought you were doing it for free, so it's
no,
well the
no,
women.
please. Maybe in the near future we might think of
you should
that.
consider
Yes,
that.
but we are doing the scan for free, so you can come and do that. We are not leaving the men too. We are having a prostate screening, a prostate scan for the men too. So with the prostate, formerly we thought that once the age advances, that is when you have issues with your prostate. But research has shown that we have prostatitis, that is inflammation of the prostate, which could even occur at an early age, 14 years, 15 years. Once you are sexually active, you can have these sexually transmitted infections causing inflammation of the prostate. So from age 14 up to 80 years, you can come in and do a prostate scan, check your prostate, see the status of your prostate, and I think it will help. We also have a kidney screening ongoing, and the kidney screening is from now till the end of the month. All the other screenings are for the entire year, but the kidney screening, we are doing it from now till the end of the month. And kidney conditions do not usually exhibit symptoms. They don't show symptoms. You would notice that your kidney is gone once your feet get swollen, your tummy becomes extended, distended. Exactly. You'd have to undergo dialysis and all that. So come and screen your kidneys. Get to know the function of your kidneys. Get to know the status. If it is functioning well, if there are fluid accumulations around the kidneys, any infection around the kidneys. We do all these for free. So you can come to our headquarters at Spintex, any of our branches. And if you want any further inquiries or further information about the type of conditions that we treat. Actually, we treat every condition, with the exception of dental issues. That's the only thing we don't do. We treat malaria, typhoid, ulcer, fertility-related issues, sperm-related issues, stroke, everything. You can call this number, 0244 867068, 0244 867068. Then you come, we will attend to you very well.
Fantastic.
Thank you very much. And if anybody wants to reach you personally, do you give a personal number out? Or
yes, that number I gave out is actually my personal number.
All right.
So 0244 867068. That's my contact.
The tech-savvy people, do you have a website for Endpoint?
Yes, we do. We actually do. endpointshomeopathicclinic.com. So endpointshomeopathicclinic.com. And we have a Facebook page also, Endpoint Homeopathic Clinic. Yeah, it will actually pop up, yes.
Right. That's beautiful, that's beautiful. We have been speaking to Dr. Kelvin Quating. He is a practitioner at Endpoint Homeopathic Clinic, and we were delving into gastroesophageal reflux diseases. The short is GERD, and if you know you are hearing or feeling anything in that part of your body, your throat, your stomach, please make sure you're visiting the hospital or the clinic so you can get treated